I would like to thank the ICS for allowing me to present this research study titled A Multi-Site Focus Group Study of U.S. Adult Women's Beliefs and Assumptions About Bladder Health and Function. I am Diane Newman. I'm an adjunct professor of urology and surgery at the University of Pennsylvania in Philadelphia, Pennsylvania, USA. And I have listed all my other co-researchers for this study. We are all part of the Prevention of Lower Urinary Tract Symptoms Research Consortium, or PLUS, called PLUS. These are my disclosures. Decision-making about bladder-related behaviors occurs multiple times each day with potential significant impact over a woman's lifetime. Beliefs and assumptions about bladder health and function influence daily toiling behaviors and early management of lower urinary tract symptoms in women. Yet little is known about how these are shaped by multi-level factors such as societal norms, media messages, health literacy, and interpersonal relationships. So this study was called the Study of Habits, Attitudes, Realities, and Experiences, or SHARE. The aim was to categorize adult women's experience, perceptions, beliefs, knowledge, and behaviors related to bladder health and function. The methods were multi, and we collected quantitative data on LUTS and toiling behavior. We used focus group methodology to gain insight from people in a shared social context. And we feel we also offer qualitative data as foundational work to inform development of a bladder health instrument. The methods are as such. We conducted 36 focus groups. We recruited women across 4 age groups, 18 years and older. We recruited 316 women, and you can see the 4 different age groups from young adult women to older women. We included urban, suburban, and rural areas across 7 U.S. research centers. And following the focus group sessions, participants were asked to complete self-administered questionnaires on demographics, physical health conditions, toiling behaviors, and LUTS status. The focus groups were audio recorded and transcribed. We reviewed all the transcripts. There was a transdisciplinary lens and inductive approach guided data interpretation of bladder beliefs and assumptions code. Team of investigators articulate interpretive insights validated by a community engagement panel. These are the demographics of the women in these focus groups on the 4 different age groups. You can see their age, race, ethnicity, and where they came from geographic-wise. Using the LUTS tool, this is what LUTS was reported by participants, and they were not recruited for their LUTS, so they may or may not, and they were not screened for their LUTS. So you can see the percentage here of urinary frequency for the first 3 questions, and question 15 to 16 asked about urinary incontinence. You can see the increase as that age group went up. As to our results and findings, limited understanding of bladder health and function with assumptions and beliefs shaped by personal experience and hearsay from friends, family, television commercials, etc. Except for the rare occasion when women had input from a medical professional, notions about bladder health and function were characterized by uncertainty, tentativeness, and unconfirmed impressions. Women speculated on the function of the lower urinary tract system, including the kidneys down to the bladder, as far as its cleansing and flushing the bodily system of impurities and toxins. They noted that there was some type of functional relationship between and among the kidneys, bladder, urethra, vagina, and pelvic floor, and they articulate a little bit about impact on bladder function of medications for chronic conditions. But assumptions and beliefs about bladder health were framed within a cause and effect perspective, covering a wide array of habits, behaviors, such as like eating and hydration habits, holding urination, exercise. As far as the interpretation of our results, we feel this is the first study to apply a socio-ecological life course perspective to characterize adult women's lay beliefs and assumptions about bladder health and function. There is a discordance between beliefs and assumptions about bladder health and function and the body of scientific knowledge used by clinicians to screen, treat women with LUTS. Women's beliefs and assumptions about where and when to void are framed within the context of toiling socialization processes in the home and schools. They often include cautionary tales based on lay experiences, Assumptions and beliefs about delayed voiding, for example, may reflect adaptations to practical concerns such as limited toiling autonomy in the workplace and reduced toilet access in public places. So, our conclusions. Across the life course, lay women's understanding of bladder function and health could benefit from input from healthcare professionals, particularly in preventive care settings where women could be encouraged to engage in healthy bladder habits. Community engaged public health messaging can inform women's assumptions and beliefs about bladder health function, educating women about the promotion of bladder health and the prevention of LUTS. This is the acknowledgement about my funding and the source. I thank you very much for allowing me to present this research.